The present pandemic has claimed at least 3.5 million lives around the world, with India accounting for more than 200,000 fatalities. With all the terrifying news around, we are constantly on a lookout for solutions that can help us protect ourselves against the disease. While everyone has turned their focus towards hand washing, sanitizers, face masks, and social distancing as means of protection against the infection, there are other inexpensive things that you can do right at home to reduce your risk of COVID-19 along with these recommended standard precautions. You may not get to see many talking about these simple remedies. One such thing is exercise. So does exercise really protect you against COVID-19? How much exercise should you do then? Is there any specific exercise that you must do? I'm going to share everything with scientific evidence in detail. It's a known fact that regular exercise has an array of health benefits like preventing blood pressure and type 2 diabetes. But what's new to the list is that regular physical activity could help protect against COVID hospitalizations. That's what a recent study says. This study was published in the British Journal of Sports Medicine by the researchers at Kaiser Permanente Fontana Medical Center, diagnosed with COVID-19 from January 2020 to end of October 2020. To measure activity levels, researchers asked each patient to self-report how many minutes they exercise each week. After analyzing their weekly physical activity with their COVID-19 response, researchers found that patients who were consistently inactive for less than 10 minutes a week had a greater risk of hospitalization, admission to the ICU, and death than those who worked 150 plus minutes a week. Dr. Robert Salas, who is a family and sports medicine specialist who conducted the studies, says something like this. Even after we control for variables such as obesity and smoking in the analysis, we still saw inactivity was strongly associated with much higher odds of hospitalization, ICU admission, and death compared with moderate physical activity. So, how does exercise protect you against COVID-19? The practice of physical exercise acts as a modulator of immune system. During and after physical exercise, pro and anti-inflammatory cytokines are released. Cytokines are small proteins that signal the immune system to fight the virus. Right after the cytokines are released, the initial response is given mainly by something called type 1 interferons. Now, what are these? Type 1 interferons play a central role in orchestrating antiviral immune response through inhibiting viral replication in the infected cells. What type 1 interferons further do is to drive the action of other immune cells like macrophages and lymphocytes. Macrophages in the immune system are called the massive eaters. Lymphocyte, on the other hand, is a type of white blood cell that is part of the immune system that produces specific antibodies to attack invading viruses. So that's how physical activity induces type 1 interferons. What the study says is that suppression of interferon 1 response has been noted in COVID-19 patients with physical inactivity. Thus, regular practice of physical activity is suggested as an auxiliary tool in strengthening and preparing the immune system to fight COVID-19. Now, the next question is, how much exercise should you do to get these benefits? The intensity of exercise does matter. According to another study published in March 2020, they found that slow walkers were almost 4 times more likely to die from COVID than brisk walkers. The study looked at 400,000 middle-aged adults in the UK. This is the first study, in fact, to show that slow walkers have a much higher risk of contracting severe COVID-19 outcomes irrespective of their weight. So let me share the guidelines for physical activities suggested by this study. Adults should do at least 150 minutes and up to 300 minutes a week if it is moderate intensity physical activity like going for a walk, or 75 minutes to 150 minutes a week of vigorous intensity aerobic activity like jogging or any form of sport. But the researchers added that even a basic recommended level of exercise such as walking 30 minutes a day, 5 days a week is enough to help your body fight off a variety of diseases, specifically COVID-19. So the bad news is if you don't have a regular exercise routine in place, you are at increased risk of suffering COVID-19. The good news is now you have a remedy to reduce the risk of COVID-19 at no extra cost. But the choice is yours. You may check the description box for the home workout routine, that is the beginner level, intermediate and advanced level workout routine that you can start right away. If you found today's video to be useful, make sure you subscribe to our channel and turn on the bell so you get notified when we upload new videos. Also, please do share the video with your friends. By sharing, you will help us touch many more lives. I wish you all God's richest blessings. This is Gerald signing off.